I'd like to welcome you to our 8-step guide to CPR in the acute hospital setting during the COVID-19 pandemic. The information in this video is based on the Resuscitation Council UK guidelines. Before we start, it's important to note that sudden events are rare and the deteriorating patient is often identified early. We recommend that all arrests be treated as COVID arrests, regardless of the clinical history or swab status. In short, if you find an unresponsive patient, what should you do? Let's get started. Step 1. Raise the alarm. Pull the emergency bell. As help arrives, ask for one person to get the cardiac arrest trolley, which has the AED device with it. A second person to don full PPE to take over at the first available opportunity. And a third person to put out a 2222 call stating the location. Step 2. Look for signs of life. Do this by checking for a response from the patient. Check for a carotid pulse if trained to do so. It is important that you do not listen for breath sounds over the face or mouth. Step 3. As per ALS algorithm, deliver up to 3 stacked shocks. So, with an AED defibrillator, put the pads on, press green to go, amber to analyse. If a shock is advised, the machine will tell you. Take the oxygen away, stand clear. And press red to shock. Immediately repeat. After 3 shocks, or if at any point a shock is not advised, CPR must start. Step 4. Check your PPE. All staff that within 2 metres of hospital inpatient should be wearing at least level 2 PPE as shown here. Do not start CPR in level 2 PPE. Whomever starts CPR must be wearing level 3 PPE as seen here. First responders in level 2 PPE should doff off at the first opportunity and leave the room, allowing team members in level 3 PPE to start CPR and follow the rest of the ALS algorithm. As the Met team arrive, each should have been assigned their role for the cardiac arrest. Each member will don the appropriate PPE and enter the room to fulfil that role only. Once all roles are full, no further person will enter the room unless requested by the team leader. This will be regulated by a coordinator outside the room. On the outside of the door, there should be at least 1 and ideally 2 members, one as a coordinator and one as a runner.
Stop there. There's a cardiac arrest going on inside this room of a COVID positive patient. What's your role in cardiac arrest?
I'm here to assess the rhythm.
Okay. We've got full PPE here. If you can put this on as quickly as possible, and when you're ready, I'll let you inside the room.
Okay.
Stop right there. There's a cardiac arrest situation going on inside this room. Do you want to be a runner? Because currently we have the required number of people inside the room.
Yes, happy to help.
Okay, I'll let you know when you're required. Just wait by this door.
It is most likely that COVID patients will arrest secondary to hypoxia. Therefore, early ventilation and intubation is key. Step 7. Airway management. Any airway manoeuvres should be done by members of the medical emergency team that have received appropriate training. This includes bag and valve masking. Any airway equipment such as face masks or laryngoscopes should be placed in a tray. Step 8. Maintain good infection control by placing Yankee suckers in a disposable glove, not on the bed or pillow. Doffing off should be done safely and appropriately, and basic hand hygiene should be applied. Post-cardiac arrest equipment should be disposed of as per local and manufacturer guidance. Deep cleaning should then go underway. This completes the video demonstration of cardiac arrest in COVID-19 pandemic. Further information can be found on the Resuscitation Council website and on the intranet. Thank you for watching.